So next is Schistosoma japonicum, also referred to as Oriental blood fluke or Oriental schistosomiasis. Now, japonicum is zoonotic and is also intestinal. It is gotten from animals and it will cause intestinal disease. Normally found in Japan, China, Taiwan, Philippines. It's a zoonotic reservoir. It infects over 30 mammalian species, including cattle, buffalo, water buffalo, rodents, these are like rats, dogs, and the humans. So habitant, the adult worm is seen in the venues of the superior mesenteric vein and the intrahepatic portal vein. So the epidemiology of Japonicum zoonosis from cats, dogs, oxen, rats, mice, sheep, water buffalo, pigs, horses. You can see all this can be infective. And there is also extensive use of night. So the extensive use of night soil can as well get to cause infection by Japonicum. So this one, yeah, there's gone. The intermediate host is still the snail, but look at the genus amphibious, okay, which survive dry periods with viable infection. The eggs can survive winter. Human infection frequently occurs in farm works, for example, when planting rice, because here you have got the water that is fresh. Okay, these people can easily get the infection. The morphology again, the males are smaller than the females. Okay, for the adult worms, and here the female when pregnant it can have up to 100 eggs, so it's the gravid female. So in each day it can pass up to 3,500 eggs. Okay, really a lot. Now the eggs are smaller and spherical with a lateral small rudimentary knob. Really don't have the spine, but it's just a small knob, and it just remained. Supposed to, it would have fully disappeared. Definitive host is the man. Intermediate host is the amphibious snail of the genus Oncomelania. Okay, and the infective form is the Metasecaria. Life cycle: the egg are going to be passed in feces. They hatch when they reach freshwater bodies or fresh water in the into Miracidia. Miracidia will now enter this Oncomelania snail, and then in the snail it will develop into the sporocyst and then into Secaria. Secaria will come out and penetrate the skin and transform into a cystosomola and go to the liver and mature there. The adult will now pair, the male and the female, migrate to the superior mesenteric vein and release about 3,000 eggs plus per day. So a lot of eggs which are released. Pathogenesis, how it really happens. So Soma mansoni japonicum target the intestinal tract and the liver, but it produces significantly more eggs. You can say 3,000 eggs per day, comparison to Schistosoma mansoni about only 300 per day. So the acute phase of infection here, that's the one that involves penetration and Katayama fever. So the Secaria will penetrate the skin and migrate to the lungs. Remember, when it penetrates the skin, to go via the portal system, go to the heart, go to the lungs, and come back to the heart. So maturation in hepatic sinusoid will trigger fever, myalgia, urticaria, mucosinophilia, Katayama fever. So this is basically where you are having a complex driven hypersensitivity reaction. Okay, similar to Manson. That's a Katayama fever. And then the adult will result into the superior mesenteric vein, releasing eggs into the intestines. The eggs that are trapped are going to cause granulomatous inflammation and make small abscesses and ulceration. So the clinical signs, there's going to be colic, abdominal pain, bloody diarrhea, and iron deficiency anemia. Because if there's bloody diarrhea, definitely you are losing a lot of blood. You are going to have anemia, iron deficiency anemia. So the chronic phase here, there's going to be a hepatosplenomegaly. When the eggs embolize, they end up going to the liver. They will initiate periportal granuloma, and that causes the Seamer's pipe stem fibrosis. The consequences, there is portal hypertension, splenomegaly, esophageal varices, GI bleeding, ascites, and also caput medusa. This is basically where you are going to see distended abdominal vessels. Okay, and then once these eggs end up going to other areas in the central nervous system, they will result in two seizures. In the pulmonary, they will result into pulmonary hypertension, genital urinary tract. They will cause also disease there, though it's rare. So the liver is going to be maximally affected. There's going to be hepatomegaly, and then followed by fibrosis, periportal fibrosis, the clay pipe stem fibrosis. Secondary, the spleen is also going to enlarge. You can see, for example, this patient here. So the eggs of Schistosoma japonica in a wall of the colon are the ones that you can see here. This is the large intestine. So the ova or Schistosoma japonica in the spinal cord is also seen. Schistosomas in the spinal cord or brain may contain large numbers of ova, often surrounded by a lot of these eosinophils. So it can lead to conditions like epilepticus in nature. Epilepsy is just having seizures, and we define epilepsy as having two or more unprovoked seizures happening greater than 24 hours apart, or having one unprovoked seizure with a likelihood that next time you might have another seizure, then you have epilepsy. So Katayama fever, that is going to happen is the acute phase of moderate or heavy infection with cystosomes, and may present as febrile reaction with hypereosinophilia. So in Katayama fever, there is basically fever, temperature which is high, also eosinophils. It can last for long. So it's the commonest in infection with Schistosoma japonica. Less common is Schistosoma mansoni and rare is Schistosoma hematobium. So commonness with the japonica. It results from the formation and circulation of antigen antibody immune complexes which provoke a type of serum sickness and may be complicated by glomerulonephritis. So another thing is that there's going to be giant urticaria. So this is basically an allergic reaction that can happen when there is this Katayama fever with Schistosoma japonica. You can see the skin changing there. So the treatment for Schistosoma japonica diagnosis is similar to that of Manson. You basically look at the stool, you look for the eggs, microscopy, okay, and then except that the eggs that don't have the lateral spine. Now, for treatment, japonica infection is more resistant to treatment than other cystosomes, although praziquantel is still the drug of choice.